Hello everyone, my name is Doug and I'm going to be presenting on the elderly living alone for environmental and cultural factors. The cultural environment for the media for this group, 46% of the U.S. population are 50 years and older. However, only about 15% of media images contain adults in this age group. The elderly are typically depicted as being helpless and secluded by the media. Media portrayal of this age group embellish stereotypes and they use outdated physical appearance characteristics. Negative representation of older people affect expectations, behaviors, and attitudes of all people and can lead to mistreatment or misunderstanding for the elderly that live alone. Negative media representation of the elderly places them at risk for depression and lack of self-worth, inviting self-neglect. The cultural environment for family support. Family support contributes significantly to the health outcomes and well-being for the elderly who live alone. The elderly who live alone are at risk for social isolation and loneliness, which puts them at great risk for physical and mental conditions such as obesity, heart disease, high blood pressure, anxiety, a weakened immune system, depression, Alzheimer's disease, cognitive declines, and even premature death. Family and friends and neighbors are the largest source of help or aid for seniors who live alone. The role of peers. Peers can play an important role in reducing the risks associated with social isolation and loneliness for seniors. Interaction with peers and building friendships is beneficial, and it increases support for seniors that live alone. Programs have been designed to intervene in reducing social isolation and loneliness. These programs attempt to provide positive peer engagement, promote social engagement, and improve social relationships and decrease loneliness for seniors. Overall, having seniors' involvement with peers has shown to increase satisfaction with life and strengthen one's social identity for the elderly, especially for those who live alone. The cyclical nature. One cyclical nature for the elderly living alone is that because they live alone, they are susceptible to the same risks every day from their environment. Some of these risks include bathing and other personal cares, getting in and out of the tub or shower, household chores such as cleaning the house, doing laundry, yard work, shopping, food insecurities, whether it's cooking or eating out, the lack of food or finances to purchase food, financial instability, they often live on a fixed income, transportation, whether they own a car or have to use public transportation, their health, if they have mobility issues, going to doctor appointments, managing their meds, social isolation and loneliness. The legal or political system. So there's a lot of politics involved. The U.S. has an increasing number of political policies focused on the aging as their numbers and needs are rapidly increasing. The federal government will spend nearly 2/3 of its budget on senior benefits by the year 2029. It is expected that those 65 years and older will make up around 20% of the population by 2029. Medicare expansions have nearly doubled the last decade, and there are proposed Social Security expansions. So potential barriers, potential cultural, environmental barriers for the elderly living alone that make them susceptible in a community include mental cognitive abilities, their health status, media stereotyping, cultural traditions, mobility, and social networking. The international scope. North America and Europe elders are more likely to live alone. Asia, Pacific, and Sub-Saharan Africa half live with extended families. Different cultures around the world have varying views on the aging and taking care of their seniors. Living arrangements differ based on the economy or economic and the cultural factors of where they live. Health disparities for socioeconomic status. Socioeconomic status affects health outcomes for the elderly who live alone. Most seniors live on a fixed income, placing the majority in the lower socioeconomic status range and below the poverty line. Gender can influence socioeconomic status for the elderly living alone, with pay gaps and also life expectancy. Living arrangements are affected by socioeconomic status and is influenced by economic booms or downturns. Around 18% of the Americans aged 65 or older were employed in 2020. Race and ethnicity. Racial and ethnic minority population aged 65 and older are set to increase by 115% compared to 29% for white seniors. Ethnic and racial minorities are at higher risks for ageism and racism. Minorities are more likely to suffer from poorer health due to growing up in higher percentages of poverty and less likely to have received medical treatments throughout their lives. Ethnic and racial minorities typically experience worse health outcomes during their senior years. Health disparities for religion. Religion and spiritual beliefs have an impact on the health outcomes for the elderly who live alone. Those who have religious or spiritual beliefs can manage stress better, reducing risks for chronic diseases. Religious and spiritual beliefs among the elderly have been shown to have positive impacts on physical, mental, and emotional health. These beliefs help the aging to adjust better to changes in their lives, such as coping with the death of a loved one or spouse, and even with living alone, the hardships of living alone. For gender plays a role in the elderly living alone, as women are almost twice as likely to live alone in their senior years than men. Elderly women are more likely to live below the poverty level as men typically have higher wages throughout their life, resulting in more retirement income. In 2019, persons reaching age 65 had an average life expectancy of an added 19.6 years. That would be 20.8 years for women and 18.2 years for men. So women do live longer than men on average. Health disparities on geographical location. Risks for the elderly living alone differ depending on the geographical location that they reside in. In some regions of Africa, the elderly who live alone are denounced and blamed for using witchcraft or sorcery, further isolating them. Disabled seniors are more likely to live alone in India. Asia has the lowest population of the elderly living alone due to their family structures. And 51% of U.S. seniors live within 9 states. The health disparities for bias. Implicit bias are attitudes or beliefs such as stereotyping without being conscious about it. And explicit bias are attitudes or beliefs that are done consciously. Implicit and explicit bias based on age is ageism. Examples of ageism in healthcare include a physician who dismisses a treatable condition as old age, treatment of the natural effect of aging as a disease, or healthcare workers applying stereotypes to older adults. Health disparities in an international scope. The international scope of health disparities for the elderly living alone are affected by access to quality health care, health status before aging, their economic status, their household arrangement, environmental impact, and their access to healthy food and water. And here are my references. And thank you very much.